This is the temporomandibular joint test, range of motion test. For this test, the patient is either sitting or standing. As the examiner, I'm standing in front of the patient. For this test, the patient is going to take 2 knuckles and place them into their mouth between the upper and lower teeth. So if you will go ahead and do that. Perfect. So this patient has normal range of motion in their TMJ joint. A positive test would be restricted motion in the TMJ joint, or not being able to put 2 fingers between the mouth. Less than 2 fingers would implicate TMJ hypomobility, while 3 or more fingers would indicate TMJ hypermobility. This is the tongue blade test. For this test, the patient is sitting in a comfortable position. As the examiner, I am standing in front of the patient while holding a tongue blade. For the evaluative procedure for this test, the tongue blade is placed into the patient's mouth. The patient will bite down on the tongue blade while resisting any twisting against the tongue blade. A positive test would be the patient being unable to hold the tongue blade in place or pain being elicited, and this would imply a mandibular fracture. This is the Romberg test. For this test, the patient stands with their feet shoulder width apart. As the examiner, I'm going to be standing lateral to the patient, ready to catch them in case they lose any balance. For the evaluative procedure, the patient will balance on the dominant leg and raise their opposite knee up while simultaneously abducting the arms to 90 degrees. So if you will go ahead and get into that position, patient. I will be here holding their balance. And for this test, the patient will close their eyes and hold that balanced position for as long as possible. That's perfect. You can stop.
I can go all day.
A positive test would be any gross unsteadiness, and this would imply a cerebellar dysfunction or cranial nerve 8 dysfunction. This is the tandem walking test. For this test, the patient begins on a white line measured at 9 feet 10 inches. For this test, I'm going to be standing next to the patient, catching them for any off balance while also timing them. So for this test, the patient is going to begin walking heel to toe with their arms abducted out to 90 degrees, and we are looking for the best time on this test. So patient, I'll count you down from 3 and you'll go when I say go. So
Eyes open.
eyes open for this one. So 3, 2, 1, go. And as soon as the patient reaches the end of the line, he will turn 180 degrees and come back. Again, I'm supporting for balance. So the patient finished it in 30 seconds. A positive test for this test would be any stepping off the line, any gross instability, or finishing the test in over 14 seconds. This test would imply cerebral or inner ear dysfunction that inhibits balance. This is the halo test. This tests for cerebrospinal fluid leakage. For this test, the patient is sitting in a comfortable, relaxed position. As the examiner, I'm going to be standing lateral to the patient, ready to put a piece of sterile gauze into the patient's ear to collect any cerebrospinal fluid leakage. For this test, gloves should be worn. The sterile gauze is formed into a triangle and placed into the patient's ear to collect a sample of any cerebrospinal fluid that is leaking. A positive test would be a yellow halo that forms on the gauze pad, and this will imply cerebrospinal fluid leakage, which would be indicative of a skull fracture.